This project was funded by Genzyme's Patient Advocacy Leadership Award to the Organization for Rare Diseases India and the RareGenomics Institute in 2016. Information about Tay Sachs disease for patients, parents, and caretakers. Tay Sachs disease is a rare, recessive, inherited disease that affects the central nervous system. Tay Sachs is progressive and exists in 3 forms: infantile, childhood, and late onset. Infantile Tay Sachs is the most common form of Tay Sachs disease. Each patient's disease progresses at different speeds and can be caused by one of more than 130 mutations on chromosome 15. These mutations cause a deficiency of the hex A peptide in the lysosomes of cells. A breakdown in the functionality of the hex A enzyme is the cause of Tay Sachs disease. It is found on chromosome 15 and disrupts the ability of hex A to hydrolyze a necessary lipid found in high concentrations in neuronal cells. This is why the brain and central nervous system are the most affected system in Tay Sachs disease patients. Referring back to founders' mutations, the best examples are within the Japanese and Ashkenazi Jewish populations. 80% of Japanese patients have one specific mutation. 94 to 98% of Ashkenazi Jewish patients have one of 3 mutations. These mutations are the population's founders' mutations. There is also a mutation that looks like Tay Sachs disease but causes none of the health issues. This is called pseudodeficiency. This mutation cannot be predicted by any test. Hex A affects the metabolic processes of both lipids and polysaccharides and is found in the cytoplasm of cellular lysosomes. In the general population, only 1 in every 320,000 inherit Tay Sachs disease. Some populations are more at risk than others. For example, Ashkenazi Jewish, French Canadian, Japanese, and Portuguese populations experience frequency rates about 1 in 2,500. The disease is also becoming more common in the Middle East. Diagnosis of Tay Sachs disease requires a number of tests consisting of hex A enzyme screening to detect enzyme activity, brain scans to look for atrophy, and genetic sequencing to identify the exact causal mutation. The select populations that have higher frequencies of Tay Sachs disease also have select mutations that are found at higher frequencies within the population. These mutations are called founders' mutations. Hex A is an enzyme that is located and functions within a lysosome. When they do not function as expected, GM2 lipids collect and accumulate within the lysosome. This eventually chokes the cell and causes the cell to die. Infantile Tay Sachs disease is characterized by little to no hex A enzyme activity. These symptoms appear between 3 and 6 months of age and begin to present as a failure to meet expected developmental milestones, such as being able to crawl or sit up. They quickly progress to neurological degeneration that affects muscle control as well as cognitive and respiratory function. Death often occurs by 5 years of age. Late onset Tay Sachs disease affects similar organ systems as infantile Tay Sachs, but are more mosaic and tend to be significantly less severe. Patients don't always present with the same set of symptoms. For example, there can be disruptions to the gait, balance, and coordination of a patient, but there can also be speech problems, intellectual impairment, and behavior problems. Occasionally, there will also be signs of psychiatric disease. Patients with late onset Tay Sachs can have near normal life expectancies. There are currently no treatments for the root cause of Tay Sachs disease. We are limited to treating the symptoms as they appear. There is, however, equipment that can make the care of a Tay Sachs disease patient easier and help reduce the risks of secondary usually respiratory, infections. The equipment available can help patients keep clear airways and help them to breathe better, as well as helping with the positioning and movement of the patient. Because impaired swallowing can be a concern, there are also feeding aids to ensure proper nutrition is maintained. Complementary, non-medical treatments include therapies to stimulate cognitive function and manage pain. These therapies can include acupuncture, as well as music, massage, and aquatic therapy. For late-onset Tay Sachs disease, PT and occupational therapy can also be helpful, as well as mental health counseling. There are some medications that can be used to treat seizures and major mental health concerns. In addition to complementary therapies, those living with Tay Sachs disease should include in their lifestyle routines that work to improve cognitive stimulation and the management of their symptoms. Again, there are tools and equipment to help with this. Preventing Tay Sachs disease is the best option available to at-risk populations. Parents can have screenings for Hex-A to predict the risk to their children. Genetic counselors can help determine the best screening options. Screening can also be done as part of IVF treatments to help choose a healthy embryo, or during amniocentesis during a pregnancy. Hex-A screening also provides a way to test children before the presentation of symptoms. This contributes to early detection and can improve treatment options. Clinical trials work to learn more about Tay Sachs disease. They hope to discover and to test new treatments for Tay Sachs. These treatments can be new medicines or something more radical like gene therapy. Trials take place all over the world. Studies currently in progress tend to be focused on late-onset Tay Sachs disease and be only observational in nature. If carriers want to have children, there are still options. As stated previously, IVF allows for the selection of healthy embryos or for the use of donor eggs or sperm. If the parents are willing to take the chance, the child has a 50% chance of being a carrier of Tay Sachs disease, a 25% chance of being Tay Sachs disease mutation free, and a 25% chance of having Tay Sachs disease. The mutation that the child would be affected by cannot be determined during screening. These doctors and organizations are currently recruiting for Tay Sachs disease studies. All of our data was gathered from the following resources. And thanks to the Organization for Rare Diseases India and the RareGenomics Institute for funding this project.